RNOH Private Care provides expert paediatric spinal surgery for children from across the UK and international patients. Our spinal surgical unit specialises in children's spine deformity, including scoliosis, which is a condition that causes the spine to curve sideways. It is usually first noticed by a change in appearance of the back. Typical signs include a visible curved spine, prominent ribs, one shoulder being higher than the other, or chest asymmetry. A referral by your specialist or GP will lead to your first outpatient appointment at the spinal surgical unit, where you will be seen for an assessment by one of our leading consultants. You will be required to have an MRI scan so we can check the position of the spinal cord and determine what type of scoliosis you have. Our hospital place specialist will explain to you what an MRI is and how it works. Your complete plan of care is discussed in a multidisciplinary team setting, ensuring the very best possible decisions are made across a number of experts and clinical fields.
This is a unique approach to private care patients at the RNOH.
Up to 2 weeks before your surgery, you will need to attend our pre-assessment clinic. Here we carry out some tests, including blood tests, spinal x-rays and heart tests, to check if you are fit for surgery. The team will explain the process, and you will be able to ask any further questions or address any concerns you may have. Once you are happy, your consent for surgery will also be taken. On the day of your surgery, you will be greeted by one of our children's nurses and taken to your private room located on the Children and Young People's Ward called Sir William Coxon Ward. Our highly trained staff provide excellent care during your stay, as well as support from school teachers, play specialists and children's nurses. One of your parents is welcome to stay in the room on the overnight sofa bed. On the day of your operation, you should not eat or drink unless told to do so by the doctors or nurses looking after you. We will give a theatre gown to wear and special stockings to prevent blood clots. When the operating theatre is ready, the nurse and the porter will take you and one of your parents into the anaesthetic room next to the theatre, before members of the team gently guide you off to sleep. Once you fall asleep, your parents will be taken back to the ward. Your operation will commence. The time you will be away from your parents could be between 4 to 5 hours. You will spend one night in the Children's High Dependency Unit, and then you will be transferred back to the ward. You will be seen by physiotherapists and occupational therapist during the next 5 to 10 days of your stay. They will help you to walk independently and prepare you for discharge home. If you need a back brace, you will be measured for this before you go home and booked into the orthotic clinic to get it fitted 1 to 2 weeks after your operation. Before you go home, we need to make sure that you're eating and drinking well, you're going to the toilet normally, your pain is well controlled, your wound is dry, you are moving about, your surgeon's happy with your x-ray. It's important to build up your stamina, so try and be active, but you should avoid all sports. We will provide you with pain medicine to go home with. We will advise you on the best way to take these. The stitches are all absorbable. Please avoid soaking the dressing, but a quick shower with the wound dressing sealed is fine. After 2 weeks, your wound is looked at by your GP practice nurse, who simply removes the dressing. You will have a number of follow-up appointments after your operation. 6 weeks, you will have an x-ray and a wounds review. 6 months, you will have an x-ray. All being well, you can start gentle PE and swimming, but no contact sports. 1 year, you will have an x-ray.
Most children can return to normal activity 1 year after surgery. Please discuss activities such as theme park rides, trampolining, rugby and high jump with your surgeon.
RNOH Private Care, treating you with care, compassion and kindness.